27 minutes past 9 a.m. Central African Time. Assalamu alaikum. Welcome back. You are tuned into News and Views on Salam Media. My name is Janwood. I'll be keeping you company for the next 30 minutes or so as we march on to 10 o'clock this morning. Yesterday, we spoke to the Calypso organization, profiling some of the work that they've been doing as far as substance and alcohol abuse is concerned. And today we continue with this humanitarian theme. We're speaking to the Islamic Medical Association of South Africa's Dr. Faisal Suleiman. Assalamu alaikum. Shukran so much for joining us this morning.
Wa alaikum salam wa rahmatullahi wa barakatuh, and thank you for having me.
All right, so Dr. Faisal, I'm looking at IMASA's newsletter this morning. It's been quite a busy year for your organization this year, hasn't it?
Absolutely. And in fact, a lot of the reports aren't included in the newsletter, but alhamdulillah, the IMA has grown substantially, and the scope and the range of our services with Allah's blessing and the help of donors, etc., has increased substantially over the years.
I'm sure many of the listeners are familiar with IMASA, or at least they've heard of it. But for those who haven't, what's some of the work that you've been engaged in over the past year at least?
Sure. How many hours do we have? So of course, it is the Islamic Medical Association of South Africa. We are part of the Federation of Islamic Medical Associations, which is about 43 countries and some associates internationally. And so there's collaboration at an international level and, of course, at a local level. We work in partnership with many of the other organizations, including Gift of the Givers, Al-Imdad, and others. Partner very often with the various radio stations. The one activity that's pretty well known is our medical file program, which gets live streamed on most of the Muslim radio stations. It's been going on for over 20 years, where we bring in specialists once a week, to discuss a topic of relevance to that week or that month, and with question and answers, etc. And of course, then our charitable activities. We also are the founders of the Ahmad Al-Qadi Hospital, and as an association do have an advocacy role as well. At the moment, two very topical ones are the Discovery Health advocacy against Discovery Health, and next year, I think in February, the Ophthalmology Society of South Africa has a congress, and one of the keynote speakers is an Israeli specialist who works at a hospital that also works with the Israeli Defense Force, or is linked with the Israeli Defense Force. So one of the programs at the moment in terms of advocacy is trying to get this Israeli disinvited as part of the whole BDS campaign, and to try and to ensure that our local optometrists, ophthalmologists, specialists do not attend this conference in protest if he's not disinvited. Similarly, there have been various issues over the past. The headscarves comes to mind. There's a policy of the Department of Health at the moment where headscarves for nurses in the public sector, there's a plan to ban that. And of course, the IMA has been at the forefront of engaging with the Department of Health to put a stop to this nonsensical policy. And so there are many other advocacy roles as well. Education in terms of the general public advisories. We release an advisory on diphtheria in the Western Cape, on meningitis. There was a severe case of a young a scholar in Durban, and we released these advisories clearly during COVID on vaccination, etc. So that is in terms of the general public. If and when appropriate, we're at the moment busy just finalizing an advisory on the use of some of these the medication, a very well-known one at the moment, intended for diabetics, being abused for weight loss in the public interest. And then, of course, there are the general education activities for medical professionals, regular webinars, continuing medical CME programs, as we call them, the annual convention of the Islamic Medical Association. So those are medical specific activities, but substantially our activities range then from the clinics that we have all over the country in terms of primary health care. Then we have our renal dialysis program, a huge shortage in the state to provide the kind of renal dialysis facilities that are needed. And IMA, alhamdulillah, has clinics all over the country, patients dispersed in about 8 centers. We have 4 clinics in 4 permanent clinics in Durban or in the KwaZulu-Natal area, Greater Durban, and then we've also got them in Western Cape, mobile clinics, in Johannesburg and in Durban as well. We've have a very successful cataract program, working in Durban with the McCord Hospital, the Eye Hospital, and then with the private specialists as well, Dr. Farooq Musa and others who have been fantastic, and Dr. Shabir Hussain in Gauteng, working and doing, literally thousands of cataract surgeries for free. We have a gift of sight program. I think they've dispensed about 700-800 pairs of spectacles this year. This year, seen thousands of patients referred, etc. And that is expanding, inshallah, to the Western Cape as well soon. We've just set up in Sherwood in Durban a dental clinic, equipped it, etc. We'll be looking for someone to work at the clinic, a dental assistant, perhaps dentist, inshallah, in the next year. So, it's a wide range of services. We built a frail care center with ongoing wheelchair aids, is a daily program, counseling, etc. That happens all in our main headquarters in Sherwood in Durban, but on a national basis as well. And as I said, in partnership with other organizations, we're part of the Muslim AIDS program. Like I said, to detail all of these, we literally need 1 or 2 hours, because although we have 3 primary centers in Durban, Johannesburg, and Cape Town, work is being done, as you would have seen in that newsletter, on the East End and the West End, a growing and very active branch in Port Elizabeth, Ladysmith, Middleburg, Carolina, Klagsdorp. So alhamdulillah, it's people may know the name, but there's a huge amount of work, and of course, all of the credit to our staff. The rest of us are academics, more in management and overseeing it, but the staff do all the hard work. So alhamdulillah, it's a combined effort of volunteers and staff serving for the pleasure of Allah subhanahu wa ta'ala.
Well, I mean, we're talking about bursary programs. We're talking about cataract program, Langa Clinic, many of these programs that your organization has embarked upon. Just finally, how can the public, wishing to make an impact, anyone wishing to make an impact, how can they get in touch with you firstly, and how can they also assist in the best possible way?
Yes, remiss of me to forget that bursary program, because we know the cost of studying and some of the health sciences courses in particular are pretty exorbitant. So we do have a health sciences bursary fund, and applications are open until sort of the end of January next year, which is just under a month away. All of the details, both about the IMA, about the applications for the health sciences, and these will be studies at recognized universities. So we don't pay for private universities. These will be recognized degrees in health sciences at tertiary institutions that we would consider. And applications are open, and all of the details, imasa.org.za. But more importantly, and to the crux of your questions, is we do accept lillah, we accept zakah, we accept other donations for all of these projects. So we really do depend. A lot of our activities are funded from some of the profits that come out of the conference, or sponsorship from the CME programs, etc. But and of course we depend hugely on the cataract. It costs on average, it costs us about 22,000 rands per annum for one dialysis patient. I think it's between 22 and 28,000 rand, depending. So that's a lot of money. And you would have seen from the newsletter we are doing dialysis. We've got patients spread out over 7 or 8 centers in the country. So we really do depend on the public donating funds. So like Zakat, Dilla, etc. All of the details on the website, and from there our offices are very easy to reach. Um, and you asked about partnerships. We always willing to work with other organizations. We happy to have younger. I mean, we didn't mention the orientation programs. We just had 4 national graduations for health sciences and postgraduate students or postgraduate specialists. So there's a lot more that is being done. Feeding schemes, daily sandwiches in some of the centers. Alhamdulillah, there's a lot. But point being, there's always a need for more, and funding is a huge challenge. Whether for the bursary fund, whether for the feeding, the dialysis, I mentioned 28,000 rand almost per annum per patient is quite steep. So we really would like, the other point to make, Zayed, is that all of us are volunteers. All of us pay our own expenses. I'm making the point because very often there's sometimes a perception, at the graduation ceremonies, the organizers, every doctor who was from the IMA, including the president, the chairman of the Durban branch, etc., all paid for their own ticket. And this is nationally like this. So, the other than staff, everybody else doesn't take a cent from the university. If there's a function, we pay for it. There's no freebies. Alhamdulillah. And we like to keep it that way so that the intentions are clear. There's no temptation to, use public funds for any other purpose than it is intended. There's no admin fee, etc. So, it's transparent. It's a well-run organization. And inshallah, we have the trust of the public, both with funding and in terms of our reputation and ability to serve the public.
Yeah, sounds like quite a bit, and I'm sure many of the volunteers and the staff must really be proud of the achievements that they've made over the past year at least, and inshallah, a lot more to be done in the coming year. You go well, stay safe, and do the best as what you do it best. Take care. Assalamu alaikum.
Wa alaikum salam wa rahmatullahi wa barakatuh, and thank you for having us on.
That was Dr. Faisal Suleiman, President of the Islamic Medical Association of South Africa, speaking to us about the various programs that they've been implementing over the past year, and much to be proud of, at least for the volunteers and staff of this organization. And those, of course, we're speaking about these organizations, and we're speaking to these organizations as part of showcasing the humanitarian work that is being done by many dedicated people across the country. Yesterday we spoke to a community organization coming out of the Free State. They're dealing with substance abuse and alcohol abuse, two of the very common challenges that are affecting our communities at a very grassroots level. And I think when we look at the news headlines all around us, it becomes very easy to be caught up in the statistics. X amount of people died yesterday, X amount of people were killed yesterday, and so many people are being robbed every day. So when we look at these news headlines, it can become very dull and gloomy. But then we look at these organizations doing whatever they can, and the many dedicated people behind these organizations offering up their services and their assistance in order to benefit their communities and uplift communities, then I think that really does give us some hope and some positivity amidst all the chaos and the despair that we see around us. It's now 20 minutes to 10 o'clock. Let's take a break. When we come back, the show continues.